Thanks for joining Optimity Advisors webinar. Today we're discussing business cases for new ways of working, the case for digital transformation in the NHS. I'm Caitlin Crossley from Optimity Advisors and I'll be your moderator. Sarah Snyder and Gareth Harper will be presenting. Gareth Harper is a managing consultant at Optimity Advisors and is our chief economist. Gareth has a great insight into investment decision-making across the UK public sector and leads Optimity's work around the economics of integrated care. Prior to joining Optimity, he was a member of the UK Government Economic Service. Sarah Snyder is a principal consultant at Optimity Advisors. She has extensive experience in healthcare policy and strategy, both in the United States and the UK. Prior to joining Optimity, she advised US healthcare providers on Medicare payment changes and also served in the US Office of Management and Budget. Without further ado, I'd like to turn over the program to Sarah.
Thank you, Caitlin. The 5-year forward view identifies 3 key gaps for health and care that must be addressed for a sustainable future: the health and well-being gap, the care and quality gap, and the funding and efficiency gap. One of the ways to fill these gaps is through information and technology, what many people call digital transformation. The 5-year forward view set an ambitious goal of paperless by 2020. This will reflect a tremendous shift in the way care is organized and delivered. Following the 5-year forward view, the National Information Board set out information and technology priorities, and in September 2015, local health and care systems were asked to produce local digital roadmaps, setting out how they would achieve the paperless goal, as well as other newly defined universal capabilities. These roadmaps were submitted in June 2016 and are now being reviewed within the broader context of the sustainability and transformation plans. While the 5-year forward view goal of paperless by 2020 refers in part to fully interoperable electronic health records, digitization is much more than that. It means a new way of working across both the health and care sectors and encompasses, among many other things, integrated digital records across health and care, allowing GPs, hospitals, community, and social care providers to all have access to a patient's information, ensuring high-quality, coordinated care. Population health data and real-time predictive analytics to identify high-risk patients. Citizen-facing technologies like mobile phone apps and wearable technologies to support self-management of long-term conditions, and improved business processes through the use of mobile, cloud, and new communication technologies. As I mentioned before, digital technology can help deliver progress against the 3 gaps identified in the 5-year forward view. The potential benefits from a digital transformation are far-reaching, and I'd like to highlight 3 distinct but interrelated benefits here with a few examples. First, and perhaps most important, digital technology can lead to better clinical outcomes. This can be seen through tools like clinical decision support systems and computerized physician order entry, which have dual benefits of improving clinical outcomes, such as reduced medication errors, and also improving efficiency through the better use of hospital resources. Second, technology can enable the more efficient and better allocation of resources. Shared patient records allow clinicians to avoid duplicative tests, and e-rostering can allow for more efficient staffing. A case study from an East London trust illustrated how electronic recording in A&E improved triage and tracking by helping identify the sickest patients most quickly and tracking and reducing waiting and registration times. Finally, using technology and data can allow providers to manage the risk of populations and patients to manage their own conditions. For example, an electronic vital signs monitoring system that produces an early warning score for staff to quickly identify deteriorating patients has been implemented in a number of trusts and already associated with the prevention of deaths, and is now being expanded to prevent infection outbreaks. Patients will be able to manage their own long-term conditions through disease-specific technology, as well as patient portals and online access to GP records. While the list of potential benefits is long, it's important to remember that they may not, and probably will not, materialize immediately. Many of us have heard the American professor Robert Wachter speak at conferences recently, and he consistently refers to the challenge of the productivity paradox, a term coined by an MIT professor which refers to the fact that when industries digitize, the expected benefits don't appear as quickly as expected. Dr. Wachter proposes that the keys to unlocking this paradox lie both in the investment in technology, but also in the people who have to reimagine and transform the way they work. Strong business cases, as Gareth will describe in a moment, will be critical to unlocking both aspects of this paradox. Little or no additional funding is expected this year for digital investments, and the amount available in future years remains uncertain. In light of limited resources and competing demands resulting from the STP and LDR processes, business cases will need to demonstrate value relative to competing resource demands, both within and outside your organization. And now I'll turn it over to Gareth.
Thank you, Sarah. And what I want to talk about now is how do you go about getting this business transformation done, and how does this relate to the business cases? As Sarah just described, digital transformation is not just about the technology, but it's about a change in the way that people and processes and technology themselves come together and deliver better value for patients. And of course, there are financial issues and challenges as well. And as Sarah just mentioned, it's unlikely that there is going to be much, if any, new money available to support transformation. And so business transformation and digital transformation proposals are going to be competing against other priorities. And it's essential that those people who are trying to take forward digital transformation convince key decision makers that their digital transformation proposal will deliver the best value for patients, for the organisation, and for the people working in that organisation as well. So these key decision makers are going to want to see a range of evidence. The sorts of things they're going to be looking to understand is the strength of the evidence underpinning the proposals around its costs, its benefits, and its effectiveness. They're also going to be interested that the proposals are credible, deliverable, and realistic. But it's also about the people. They're going to want to know that all key stakeholders agree with the proposals, are engaged, and are on board with the transformation ideas. And in addition, the finance teams are going to need to be convinced that the proposals are affordable and demonstrate value for money against any alternatives. And those sitting on the board might be interested in understanding and want to be confident that the proposals fit in with the wider strategic objectives of the organisation. What I've just described there is a business case, and the business case in itself is a story. It's important that through the development of the business case and over the time frame involved, you develop a narrative to engage with stakeholders and make sure that the right people are on board with the changes you are proposing. These could be patients, these could be staff, these could be finance teams as well as senior managers. Now the financial aspects are a piece of this, but they are not the whole picture, and it's important that the business case continues to evolve over time. The Treasury 5-case model provides an excellent framework for taking large-scale projects from inception through to implementation. And there are three main stages to this model which I've set out on this slide. The first is the strategic outline business case. This focuses on making the very high-level case for change. It's about understanding what are the problems that the change might look to address. It's understanding about who needs to be engaged in ensuring that change happens, and also what benefits might be achieved by making such a change. Once through that strategic outline business case stage, you move into the phase of developing the outline business case. This is getting into the issues around options appraisal. You'll be looking to develop alternative options for change against a do-nothing scenario and begin to make recommendations for a preferred option. This will involve developing a financial assessment of each of the options, identifying the risks and the benefits associated with those options, and start to think about what this might mean in terms of implementation. And as you move on, you'll then move towards a final or full business case. This presents the final assessment of the preferred option which had been identified in the previous stage. It will include a full and detailed financial and implementation plan and set out ideas and proposals for transition towards going live. The conclusion of the full business case stage results in a go, no-go decision for rollout. At each stage of the business case, there are a number of questions that need to be addressed. And these different questions can be categorized under 5 separate individual cases. The first, the strategic case, which is often dealt with in detail at the strategic outline business case stage, asks the questions about what needs to be addressed, what alternatives are there to going digital, what happens if we don't do this, and also asks questions around who are the key stakeholders, and can you develop a stakeholder engagement plan from the outset to ensure that this strategic case is understood and convincing to all those that need to understand it. Moving on from the strategic case, you then get into what's known as the economic case. This addresses questions around value for money. What are the benefits associated with the transformation? Who will accrue these? Is it patients, providers, or commissioners, or all three? And how do you go about defining the benefits? How will they be measured? And when might they be realised? This is closely connected to the financial case. The financial case very much deals with the financial implications, such as capital requirements, cash flow, revenue, for example. So the questions here are, what are the initial investment and ongoing maintenance costs? And what funding is available over the lifetime of the proposal to deliver the transformation? As you move towards the questions around implementation, you then start to think about the commercial case. This is very much around the concerns around the supply chain and the market in which you might be operating. If you're looking to buy kit and equipment, what vendors and what products are currently available? Are you looking at an off-the-shelf product, or are you looking for something bespoke? And how does that relate to the financial case, which we've already discussed? And equally, what does the supply chain look like, if necessary, and how will you manage this, and how will the contractual arrangements be set up in that supply chain? And that then links through very much to the management case. What is the implementation and delivery risk? NHS IT projects in the past have seen many delivery failures, so how can we avoid the mistakes from those previous examples? Do you have the appropriate governance structures in place? Do you have the appropriate management structures in place? And if there is a supply chain, have you got the appropriate contractual and remuneration packages in place? So I've spoken there about the theory and the methodology behind doing business cases. What I'd like to touch on now are 5 common mistakes that have been observed in developing business cases, and what you might go about doing to avoid them when thinking about digital transformation business cases. The first is trying too much too soon. When people hear that they have to undertake and complete a business case, minds get going into thinking about options appraisal, cost-benefit analysis, developing budgets, thinking about implementation plans, setting up governance and structures. And they're important, but as I've already described, that is further down the line than actually trying to understand what is the objective of what you're trying to achieve, what stakeholders need to be engaged with, and how do you go about developing that implementation, that engagement plan, and taking it forward to implementation. So the idea here is that it's very important to understand that you don't need to get it right the first time in developing the strategic outline case, and you approach this process methodologically and sequentially. The second point is about ignoring the strategic case. Again, far too often when thinking about business cases, teams think immediately about the financial aspects. It's about developing a financial case for change. Is it going to save us money? But a business case is not just about the numbers. As I said earlier, it's a story, it's a narrative which needs to engage people. So stakeholder engagement about the vision at the early stages is equally as important. So a common and strong message here is it is essential to engage with stakeholders early and often throughout the lifetime of the business case procedure. The third issue I'd like to talk about is the difference between the financial and the economic cases, which is a common misunderstanding. The financial case tries to answer the question, can we afford it? The economic case tries to answer the question, does it demonstrate value for money? And they are 2 different questions. The financial case is about understanding the availability of resources, the availability of funding, and what are the costs. The economic case is about understanding the costs, the benefits, and comparing the 2, and then comparing those against an alternative to see whether or not this is the best course of action. So it's very important to understand both the affordability question and the value for money, and it's important to develop a narrative for the economic case, because quite often those benefits may not be financial benefits, but maybe benefits to patients in terms of patient experience and patient outcomes. The fourth issue I'd like to talk about is the assumptions which underpin your business case. All business cases and models will involve assumptions, and it's important to revisit and test these, especially around the finances throughout the different stages of the business case. It's a common trap to fall into, to think at the outline business case stage that we've worked through the financial costings and therefore that work is done and we don't need to think about it. But as you move into implementation thinking and governance arrangements, you may find that there are potential contingencies and mitigation strategies which you need to build into because it is taking time to implement what you had planned already. And as a result, though, that may have a consequence on costs as your status quo needs to be maintained. And it's often the case that these mitigation and contingencies are not reflected in the financial case. So it's important that you revisit and test your assumptions, especially around finances. And fifthly, there's the issue around estates and IT. Quite often, the biggest generators of value may come from releasing value from estates and also from improved efficiency from technology, especially information technology. But these are often areas where information about the current position is weak, or future expected trends are highly uncertain, and there may be a range of competing initiatives, especially in the space of IT, which might complicate issues such as additional costs and additional benefits and how these might be attributed. I'd like to hand back now to Sarah to conclude the presentation.
Thank you, Gareth. To conclude, I'd like to just tie your points about business case development back to the digital transformation in health. As you've mentioned before, the business case encompasses nearly every aspect of your change, including people, markets, implementation, governance, strategy, and resources. Similarly, the digital transformation will rely heavily on people and transforming existing ways of working. As we've heard from a lot of people recently, the goal of the digital transformation isn't just to go digital, it's to change the way healthcare is delivered and to increase value. This means that the business case is not just another exercise, but an invaluable tool for successful planning and implementation. Doing it well can make the path forward just a bit easier. Thank you for taking the time to listen to this presentation. Please reach out to either one of us or anyone at Optimity Advisors with any questions. Thank you.